Okay, so we talked about chemotherapy, what it does to your body, and what kind of side effects you get from it. In this video, I'm splitting the management of these side effects into two videos. So in this one, we will talk about alopecia, fatigue, peripheral neuropathy, dry skin, and dehydration. And in the other video, we'll be talking about two of the most important side effects from chemotherapy, and those are neutropenia from lowering the white cell count, the infection-fighting cells, causing infection, and nausea and vomiting from chemotherapy. Also, some important side effects include chemo brain, mouth sores, and pain. All right, I hope you find it helpful. Exercise is extremely important to combat fatigue. You can stay active by simply walking every day for 20 or 30 minutes. Nothing strenuous. Or by doing yoga. Just please don't sit around if you can help it. And also remember, steady wins the race. That's where you want to be. Alopecia. This can be prevented with a cold cap. There are multiple different brand names out there on the market, and they are successful for the most part with certain chemotherapy drugs. But talk to your oncologist if you think that you want to use them and whether your insurance company will cover them. Unfortunately, many of them are not covered yet by insurance. And honestly, the cost and hassle associated with them is not worth it for many patients by the time I'm done explaining the whole process to them. A lot of times, those patients have to come in hours before their regimen and stay for a few hours after their regimen. And when they go home, they're not allowed to comb their hair. And some of them end up losing their hair anyway towards the end because their hair is just up in a matted ball. And to top it off, they don't really work for sure for some chemo drugs. The temporary nature of this alopecia from chemotherapy makes it okay for a lot of patients to go through the motions for 4 to 6 months before they get their hair back. Although there's a teeny tiny risk of having permanent hair loss, taxotere, I'm seeing that on some commercials. Even though I've never seen that in thousands of patients I've treated in my time, your hair will eventually grow back. And in my experience, it's a beautiful stage of my patients' recovery, especially the females. They have those gorgeous curls that eventually go back to their normal hair consistency. But in any event, talk to your oncologist if you want to consider this option for yourself. For peripheral neuropathy of the hands and feet, again, depending on the type of chemo you're getting, the schedule, the dose, and what else you may have going on, like diabetic neuropathy, for example, you may be able to lessen the potential severity of this neuropathy by using ice packs or even frozen vegetable bags. Bring them with you to the infusion clinic. Just tape around your hands while you're having chemotherapy infused. That is a low-cost way of trying to lessen the severity of it. Again, it doesn't completely prevent it, but it's worth trying. We do have medications to treat peripheral neuropathy from chemotherapy that are FDA approved, but they are the same ones we use to treat other neuropathy caused by other reasons. Cymbalta is the only one that's FDA approved, but honestly, in my experience, it's as shoddy as gabapentin. Just know that if you have numbness, nothing will help that. No medications out there will help numbness. And all of the ones we have on the market usually help with the painful tingling part. You may take a multivitamin a day while you're on chemotherapy. Just don't go crazy with megadoses of antioxidants and herbs such as turmeric, because they may shield cancer cells just as well as they shield your normal cells, and you don't want that. Keep your skin well moisturized, and for that, you may need to pull out your big guns if need be. Udder Cream, CeraVe, Gold Bond, Eucerin, and others. And use the creams rather than lotions if you have to. For the hand-foot syndrome, we may have to use prescription-strength urea-containing cream to keep your skin soft and keep it from cracking. Apply your creams a lot and apply them often. There are a few other hacks that I'll go over in other videos to maximize the use of those creams. That includes a compounding cream that I usually prescribe to my patients that don't only suffer from the hand-foot syndrome, but also peripheral neuropathy. And it's a combination of 4 or 5 medications compounded by a compounding pharmacy, so you can't walk up and get it at the normal drugstore. Let me know in the comment section if you would like me to share my favorite formula with you. I'll be happy to do so. And lastly, hydrate, hydrate, hydrate. I cannot emphasize this enough, though. If you're someone with heart failure or kidney failure, you may be at risk for kind of overshooting with being fluid overloaded or being too dry. And it's extremely important that you stick to the advice of not only your oncologist, but your cardiologist. And they need to communicate to make sure that your fluid state is optimized. But back to hydration, really a lot of grief can be prevented with adequate hydration. Having said that, some patients seem to be doing everything right, and they still seem dehydrated. It's okay. It's not you. That does tend to happen sometimes. What does dehydrated even look like? Well, that's when you feel tired, you feel like you're blacking out, you're about to pass out, your blood pressure is low, your heart rate is fast, and when we get some blood work, we can tell that you're dehydrated. And you really have to be in tune with your body. Some people, this creeps up on them, and before they know it, they end up in the hospital. To prevent a hospitalization, please call your oncologist or your team, whoever your contact person is in the clinic, to let them know how you're feeling. All of this may be avoided by you just paying a visit to the infusion center and getting IV fluids and whatever else they think you need. IV fluids can do you good in many other situations, such as nausea, fatigue, acute temporary kidney injury, or ringing in your ears. Also, chemotherapy can mess with your electrolytes, such as your sodium, your potassium, your magnesium. That's another part of the reason we may think, IV fluids may be a good option for you and may want you to come in to be checked if you call in with certain symptoms. Next, that nonsense about flushing the toilet twice and staying away from pregnant women while you're on chemo is rubbish. I just disregard that. Next, yes, you can have sex during chemotherapy. Just make sure you wear a condom. And for women, even for men, you need to make sure that you're using contraception because a lot of chemotherapies can cause congenital anomalies in babies. All right, I think I've covered more than 90% of what to expect when you're expecting chemotherapy. I hope you found it helpful. Please let me know in the comments section if you have any specific questions to any specific part of the video. I've also time-stamped each point in my video for your easy viewing. If you're not getting chemo, but rather immunotherapy or any other targeted therapies, make sure you check out my other videos talking about those drugs. Parting thoughts for this video. Don't forget to live your life to the fullest, even while having cancer. I do realize that living life to the fullest means something different to every one of us, but I'm curious to know what some of you do from time to time while going through all of this to keep things in perspective. I'm always learning something new from fighters like you. Remember, you may have cancer, but cancer does not have you. Good luck.